How can I help you today?
You can't. There's nothing wrong with me.
Well, you must have come in for some reason, right?
You don't think there's something wrong with me, do you? Because there's not. My parents made me come in here. Just feeling a little down.
Why would your parents bring you in if you were simply feeling low?
They read a note I wrote my girlfriend. I told her I was going to kill myself if she didn't start going back out with me. But no, I don't normally feel this way.
Have you ever had thoughts of hurting yourself before?
No, I didn't mean it. I just wanted to get her attention.
Have you experienced any changes in your sleeping and eating patterns?
No, does it look like it to you?
That's an interesting choice of clothing, don't you think?
No, I just like the attention I get when I wear this.
You mentioned before that the suicide note was to get your ex-girlfriend's attention. Do you feel you need a certain level of attention from those around you?
Yes, I deserve the attention. How can anyone not pay attention to me?
What if they don't give you the interest you feel you ought to have?
I'll do whatever I can to get it. I don't feel right or comfortable when I'm not the center of attention.
I'd like to talk about your ex-girlfriend. Can you describe the relationship you had?
Well, she didn't ever appreciate me or the things I did for her. We fought a lot, and she always accused me of being overly dramatic. I don't think I was being dramatic at all. I mean, I loved her more than anything. Then out of nowhere, she just broke up.
You two must have been very serious. It must have been very difficult when she ended the relationship. How long were you together?
A couple weeks.
Saying I love you is a very serious thing to say. Do you think she loved you too?
She said she wasn't ready to say the words, but I knew deep down she did. I always felt so great when I was around her. I felt so up.
Did you ever feel so up that you didn't need sleep?
No.
I'd like to talk about the ways you get attention. I know you dress a certain way for attention, but do you ever use drugs that aren't prescribed to you by a physician that may lead you to act in a way to get attention?
No, never.
Alcohol, maybe?
Not really.
Have you ever heard voices or maybe seen things that others can't see?
What? No.
Then brought the patient in. Depression was the first disorder to question for. When asked if the patient often felt sad or depressed, he answered no. To further rule out depression, sleeping and eating patterns were also asked about. Again, the patient explained that they had none of these symptoms. Major depression was out. I was then led to borderline personality disorder, as a symptom of which is attention-seeking self-mutilation, the reason for the visit. However, the dress of the patient and the patient's fondness for attention led away from bipolar personality disorder. Perhaps then narcissistic personality disorder should be considered. A narcissistic individual would believe they are superior and deserve attention and special treatment. Due to the patient's nonchalant answer, narcissistic personality disorder was thrown out. Fears of rejection and criticism were focused on for dependent personality disorder. The patient possessed both, but the patient was not dependent on others for happiness or fear of abandonment, and therefore dependent personality disorder was excluded as well. Histrionic personality disorder is now focused on. Histrionic personality disorder gender trends have the tendency to lean in the direction of females, so it was not necessarily a clear-cut diagnosis. Only after a number of follow-up questions and the patient's behavior observed was the diagnosis made conclusive.